I think keep learning. Go to as many conferences as you can. Continue to learn. Don't get frustrated. Some things have a bigger learning curve than others.
Like
but
threads.
Threads
Threads have a
do.
huge learning curve.
Sometimes cannulas for some do, but that was something that I think changed my practice overall. So a cannula is worth learning. And make friends too. Have a buddy or a friend in the industry that you can bounce ideas off of, and that you can learn together. So find a good learning buddy.
I think that's really important, finding a mentorship. So there's many different organizations, whether it's IAFA or ISPAN, there's so many different ones where you can develop mentorship. Find that person that you trust and you can bounce ideas off of. Training always, every 3 to 6 months. And just because you learned one way and then the next time you hear a different way doesn't mean the old way was wrong. It's just there's many ways to skin a cat, and be open-minded. But I ultimately think if you can use safety as your North Star, I think you're always going to be going in the right direction and do good. Good for your patients, good for your practice, good for your soul and mental health. I think that don't be afraid to make mistakes, keep learning, and keep safety and your patients' safety as your North Star.
I learn something new every week. You know, so
if you're not learning, you're not growing.
Yeah.
You're like dying. You just always have to do something.